Assalamu alaikum doctors. Let's discuss today a very important topic that is termed as monkeypox. As the disease is progressively increases day by day, so we need to understand the monkeypox from the scratch. So let's discuss the monkeypox. So it is a viral zoonotic disease. It is a viral zoonotic disease. So what does it mean? It means the disease is readily transmitted from animals to humans. So it is important. Secondly, why it is called as monkeypox? So why it is called as monkeypox? The reason is the disease is first discovered in monkey. The disease first discovered in monkey. Because colonies of monkey develop a pox-like disease, that's the reason it is termed as monkeypox. So it is first discovered in monkey, but it is also present in certain animals and human primates. It is also present in certain animals like rodents and human primates. So this disease is also present in rodents like rats and rabbits, while also it is present in human primates like monkeys, chimpanzees and squirrels. So it is important. So when the disease is discovered, so the disease is first discovered in 1958. The disease is first discovered in 1958 in animals, while if we talk about in humans, the disease is first discovered in 1970, where there was a time when there was an actively immunization was done, there was vaccination was performed against the smallpox. So at that time there was a state by name Congo, where the first case is being reported. So it is important. So in 1958 it is first discovered in animals, while in 1970 it is first discovered in humans. Now, what is the causative agent of monkeypox? So the causative agent of monkeypox, that is called as monkeypox virus. Monkeypox virus. Now, monkeypox virus, it is a break shape. What is the shape of the virus? It is a break shape or oval shape. And it is a double-stranded, it is an enlarged double-stranded DNA virus. So I repeat, the monkeypox virus, it is brick shape or oval in shape, it is enlarged double-stranded DNA virus. So what is the family of monkeypox virus? So the family of monkeypox virus is that is called as Pox viridae family. And what is the genus of monkeypox? That is orthopox virus. So the family of monkeypox is Pox viridae, while the genus is orthopox virus. So the Pox viridae family, it also consists of smallpox, chickenpox and monkeypox. That's the reason that the monkeypox, it is so similar to the smallpox. As the monkeypox and smallpox belong to the same family, that's the reason the monkeypox is related to the smallpox. Secondly, the genus of the monkeypox is orthopox virus. Orthopox virus comprises of variola virus. It consists of variola virus. It consists of vaccinia virus. Also, it consists of cowpox virus. So the orthopox virus consists of variola virus, it consists of vaccinia virus, and it consists of cowpox virus. So this variola virus, it causes the smallpox. This vaccinia virus is a vaccine for the smallpox, and a cowpox virus, it is also a vaccine, and it causes the smallpox. So that's all about the general introduction of monkeypox. Now let's talk about the types of monkeypox or genetic clade of monkeypox. So there are two types of monkeypox. That is Central African clade and Western African clade. So what is the genetic clade? Genetic clade. The genetic clade of monkeypox, it consists of Central African clade and it consists of Western African clade. Now, as you know that the monkeypox, it is a disease which is endemic in the Africans. So there is Central African clade and Western African clade, and the Central African clade, it consists of Democratic Republic of Congo and Cameroon, etc. While in another hand, in Western African clade, it consists of Ghana, Liberia, etc. So the Central African clade, it is the most severe and most dangerous type of monkeypox. So it is the most dangerous type of monkeypox as compared to Western African clade. Secondly, what is the mortality rate for the Central African clade? And the Central African clade, the mortality rate is being reported as 10%, while in Western African clade, the mortality rate is being considered and is being reported at 1 to 3%. So Central African clade, it is more severe form of monkeypox, and Western African clade, it is the less severe form of the monkeypox. So let's discuss the transmission of monkeypox, that how actually the disease is transmitted from one person to another person. So let's discuss the transmission. So the disease is transmitted from animals to human as well, and from humans to human as well. So what is the transmission of monkeypox? So the disease is also transmitted from animals to humans. Also, it is transmitted from humans to humans. Now, when human comes in contact with infected animals' blood, bodily fluids, also skin or mucous membrane. So how the disease is transmitted from animals to humans? So when human comes in contact with infected animals, so it transmitted from the infected animal's blood, body fluids, and the skin and mucous membrane. While in another hand, how the disease is transmitted from human to human, so it is most commonly transmitted through respiratory droplets. Respiratory droplets, like if someone like cough or sneeze, so it is the most common way to transfer the disease from human to human. Secondly, also direct skin to skin contact, and sexual contact. So I repeat, the disease is transmitted from animals to humans I repeat, how it is transmitted from animals to human when someone comes in contact with the infected animal's blood or skin, so it can be transmitted. And another hand, from human to human, the transmission is done by respiratory droplets, direct skin to skin contact, and sexual contact. Now let's discuss the pathogenesis and certain clinical presentation of a patient if someone is suffering from their monkeypox. Now, what is the incubation period of the monkeypox? So the incubation period of monkeypox is 6 to 13 days or 5 to 21 days. Now, what is incubation period? Incubation period is the interval between infection and appearance of clinical presentations. It is actually the interval between infections and appearance of signs and symptoms of a patient. So the incubation period is 6 to 13 days or it is 5 to 21 days. So how actually monkeypox causes a disease? Actually this monkeypox, it get entered into the body, and after completion of incubation period, it causes certain clinical manifestations. So the clinical sign and symptoms, it is divided into two phases. The first phase is called as invasive phase, and the other is called as skin eruption phase. So the invasive phase, it persists up to 5 days. While skin eruption phase, it persists beyond the 5 days. Now, in invasive phase, the patient usually presented with the fever along with chills. Also, there is body aches, there is backaches, exhaustion, and there is a very important feature that is called as lymphadenopathy, means enlargement of lymph nodes. And actually this is the lymphadenopathy, which is the distinctive feature of the monkeypox that differentiate the monkeypox from the smallpox. So the sign and symptom consist of fever, which is there is bodyaches, there is backaches, exhaustion, and the enlargement of lymph nodes. While in another hand, and skin eruption phase, there is appearance of rashes. There is appearance of rashes. This rashes develop as the fever subsided. Initially the fever, it is more pronounced in the face area, and then it distributed to the rest of the body, even it involved the palms and toes. So it is very important that the rashes that is developed and the monkeypox, initially it affect the face. After that it distributed throughout the body. Also palms and toes are involved. Now, what is the pattern of rashes in the disease of monkeypox? So initially the rashes that is developed here, initially there is vesicle. Here is vesicle. After vesicle it become papule, then it become umbilicated papule, which lead to the ulcerating lesions, often lead to the crusting, and finally it lead to the scab lesion. So the pattern of rash in monkeypox is important. Initially there is vesicles, and the diameter of vesicles here, that is approximately 3 mm. Vesicle means if any pouch containing fluids, that is called as vesicles. After that there is papule, that is around about 2 mm, and here in papule it is actually when the blisters appear on skin that containing a pus, so that is called as papule. After that there is umbilicated papule, also it is 3 mm in diameter, and it is just like papule, but it is look like an umbilicus. That's why it's called as umbilicated papule. After that there is ulcerating lesion, and the diameter is around about 3 mm here, and which lead to crusting and scab lesion at the end. So the rash pattern is important, the rash distribution is very important. Now let's discuss the diagnostic evaluation of a disease, how the disease is clinically diagnosed, and how we will assess the disease in a lab. Now let's discuss the diagnostic evaluation. Diagnostic evaluation. So first of all, the clinical features is also very important. The clinical features important. By seeing the certain clinical features, like if there is a fever with chills, body aches, if there is enlargement of lymph nodes, and if there is rashes is developed as the fever subsides, so we will be thinking for the monkeypox. Also, on CBC we will be doing the polymerase chain reaction, PCR. It is very important. So in this condition of monkeypox, the PCR, it is considered as a confirmatory test. It is confirmatory test, and it shows the viremia. Also, we can go for skin biopsy. We remove the skin tissue and we will check it for the virus. So there is three approaches: by just looking the clinical sign and symptoms of a patient, by doing PCR, and by skin biopsy. Now let's discuss the treatment option. What is the treatment? Now, so the mainly treatment of monkeypox is supportive. So the first approach, there is supportive treatment, like you keep the patient hydrated, give antipyretic if there is a fever, give diclofenac if there is a pain to the patient. So mainly the treatment is supportive. While in another hand, there are certain antiviral medications are available as well. There are certain antiviral medications. And what are those antiviral medications? The first is, that is called as tecovirimat. Tecovirimat, 600 mg per orally, 2 times a day for 14 days. Now, give tecovirimat 600 mg per orally 2 times a day for 14 days. Now, the major side effect of tecovirimat is headache, and that is reported in more than 10% cases. While less than 10% cases, the side effects are nausea, vomiting, and abdominal pain. So, the major side effect of tecovirimat is headache, while the other certain side effects are nausea, vomiting, abdominal pain. So, what is the major mechanism of action of tecovirimat? Actually, it inhibits the major protein. It inhibits the major protein envelope which helps in synthesis of virus, monkeypox virus. So it actually inhabits the envelope of proteins, which actually it helps in the synthesis of virus. That's how it's inhabit the growth of the virus. Now, what is the second approach? What is the second medicine? That is brincidofovir, and that is 200 mg per orally into 2 doses. So the second medication is brincidofovir, 200 mg per orally and 2 doses. Now, what is the major mechanism of action of the brincidofovir? Actually, what actually do? It target cells. Actually, it target the lipid portion of the cells. It target the lipid portion of cell and release the cidofovir. Later, the cidofovir it phosphorylated into cidofovir diphosphate with the help of an intracellular enzymes, and that is termed as kinases. So ultimately, it inhibits the synthesis of DNA. So the mechanism of action of brincidofovir is it targets the lipid portion of the cell and release the cidofovir and phosphorylated into cidofovir diphosphate with the help of intracellular enzyme kinases. And the major function of cidofovir diphosphate is that it helps in the inhibition of the DNA. So what is the third antiviral medication? That is called as cidofovir. But actually it is not given as such because it creates a lot of problems, mainly in kidney. So it causes kidney problems. So that's why mainly it is avoided. So there are smallpox vaccines are available as well. Smallpox vaccines do play role here. So that is ACAM 2000 and Jones vaccine. But the Jones vaccine play an important role in immunocompetent patient. Now, and also in 85% cases, the smallpox vaccine is effective against monkeypox. So the vaccine that is play a role, the vaccine that play an important role here, that is termed as smallpox vaccine in the form of ACAM 2000 and Jones vaccines. And also it is very important that in 85% cases the smallpox vaccine it is effective against the monkeypox. So students, that's all about the monkeypox. So thank you so much.